So as we mark the 10th anniversary of World Cancer Day, what advancements have been made in the fight against the disease? I spoke with Dr. Randall Holcombe from New York's Mount Sinai Hospital. He is Deputy Director of the Tisch Cancer Institute there.
Well, I think we've made progress over the last 10 years, but there's still a lot of room to go. We have seen a reduction in the death rate from cancer over the last few decades, and that's very encouraging. And I think some of the new approaches and new paradigms to cancer treatment are really exciting, and we are hopeful that the death rate will continue to fall over the next few decades.
Where are you seeing the biggest advancements?
Well, I think most recently the biggest advancements have been in our advances in genomics and proteomics. That's the genes that are altered in cancer and also the protein expression that's altered in cancer. We've learned a lot about this over the last several years, and we've started to develop treatments that are tailored to the specific genetic mutations that an individual patient's cancer may have.
Talk about the cost of cancer funding and how it relates to the gains that we've been seeing in survival rates.
So we have spent a lot of money on cancer research since President Nixon announced his war on cancer back in the 70s. We've spent about $500 billion on cancer research. That's about $12 billion a year. On the other hand, when you look at it from the perspective that it costs about $88 billion a year to treat patients with cancer, the amount of money that we put into research really pales in comparison. About 2 decades ago, if you got cancer, about 1 in 4 individuals could expect to be alive after 10 years. Presumably those individuals were cured. Today, if you get cancer, about 2 in 4 individuals can expect to be alive after 10 years. I think that the research money that has been spent has been fairly well spent, but we'd certainly like to see much more dramatic gains. Some of the gains have been incremental in some diseases, but they've been very dramatic in others.
For a lot of people, though, who are suffering from cancer, the cost of treatment is still in the tens of thousands of dollars per treatment. It's a lot of money, as you mentioned. So do you see a day where the costs will come down for patients? And are we any closer to finding a cure to cancer?
Well, I think we're closer. I think we know a lot more about the biology of cancer than we used to, and that helps us develop specific therapies for patients. And we also know a lot more about the immune system, and there are some exciting advances that are occurring in respect to immune therapy. But the cost at the moment is great. The cost of cancer care is greatest for those patients with widespread disease or metastatic stage 4 disease. And it is those patients who have the most difficulty in curing. So if we want to really reduce the cost of cancer care, we have to find disease early, which means better screening techniques and encouraging individuals to participate in those screening techniques so that we can catch cancer early and more easily cure it, and also to put more money into research for cancer prevention.
That was Dr. Randall Holcombe of Mount Sinai Hospital in New York.